tracing programmes have already begun in both England and Scotland. Northern Ireland has a version up and running, whilst the scheme in Wales is due to start on Monday. But what happens to the data that's gathered? Where is it stored? Let's talk to Ronan, Lyons, Professor of Public Health at Swansea University and co-director of the Databank. And that brings together anonymous health data from around the UK, which can be tracked over time. He also sits on the Welsh Government's COVID-19 Technology Advisory Group. Morning to you.
Good morning.
And that is your sage, in a sense, isn't it? So you're right at the heart of decisions that are being made or feeding information so that ministers can make decisions about how to move forward.
Yes, the Technical Advisory Group meet to provide advice to Welsh Government on how the epidemic is unfolding, what's happening, what's working and what isn't.
Right, and this data bank, it's, you set up this model and it's used the world over now, isn't it?
Yes, back 12 years ago we set up the Databank. SaIL stands for Secure Anonymised Information Linkage. It's a privacy protecting system which allows data from multiple sources, principally the NHS but others, to be anonymised and put together. And then it's possible for the researchers to track what happens to people over time without ever knowing who they are, and to evaluate what interventions work and don't work.
Right, so you are very much at the centre of this test and trace system that is happening in Wales. So, we had the Welsh minister, the health minister, Vaughan Gething, saying yesterday contact tracing will begin on a phased basis from Monday. So how might you be involved once that whole system is up and running?
Well, there are a team of wonderful people who are helping bring data together and make sense out of it so that we really understand what is happening. And on top of that, then there are various interventions happening, so one of which is contact tracing. So there are many other things that are also going on. But we will be able to track in very near real time how many infections we have and how many contacts are traced, and whether that's working, and whether we hope it will work very well. And if people observe the social, physical distancing and observe the contact tracing rules, that should cut down the amount of infection considerably.
And is this the kind of information? Sorry, carry on.
Yes. I think the modelers have said that will have an effect of up to 15% reduction, so it's not everything. And it's very important for people to realise that the 2 metre physical distancing thing is really important to continue.
Yeah, and will that kind of information feed into potentially somewhere down the line? We were talking about this on the programme yesterday, about potentially if you see a rise in infections in some areas, you could see more targeted local lockdowns. Is that one way this information could be used?
Yes, certainly if you see a rise in areas, then that gives people pause for thought as to what's the best thing to do about it. Whether that's a lockdown or other activity, more enhanced contact tracing, I couldn't say at this point in time, but it gives early warning that things are not going as well as expected and more needs to be done.
I mean, what we're getting to on the programme, and we've spoken about this for quite some time, is the variance of guidance and rules between the nation states of the United Kingdom. And of course you have a situation in Wales where it's very much visit Wales later for people in Wales who live in Wales to stay local. In England, though, you can travel any distance you want now for exercise. And we see pictures of crowds on beaches in southern England, all over the country, from Skegness to Southend. Wales, those restrictions are still tight and will continue to be tight. What do you think then to that kind of messaging and how it affects the behaviour of the public?
Well, I understand the First Minister is going to make an announcement later today on the changes in some of those things, so I'm not quite sure what he's going to say. But there are differences. Some of the differences are more subtle than are made out. But undoubtedly, the fact that different countries are doing things slightly differently will add to an element of confusion in the public mind.
And is that helpful?
It would be better if there wasn't, there.
So you would have welcomed a more cohesive approach between the nation states?
I think that would be very helpful, yes. I appreciate there are different politics involved, and of course devolution means that each country has the power to decide what is most appropriate for it, and is doing that.
Some would say politics shouldn't even come into a global pandemic. I hear what you're saying there. Let's talk about testing capacity then. Public Health Wales figures show that 2,206 tests took place on Tuesday of this week. The Welsh Government has a target of 10,000 tests a day. Again, that's politics and practicalities sort of bumping up against one another. What do you think to government setting targets when the system is clearly, if you look at those figures, maybe not gearing up to hit that target anytime soon?
That's probably, if you like, a political decision. My interest in this is really tracking what happens and what's working. I do think it's easy to come up with large numbers, but the capacity of the system to respond to that also has to be there. And often that has been lagging a bit behind the aspirations.
And just final question, people will be concerned that, as many people asking questions about, is their data safe? What can you tell people listening in Wales today about the Databank and the information that's going to be stored on them through the new test and trace system?
So this is a very well-established privacy protecting system. It took 2 years in the planning, and there was a lot of consultation in doing so. None of the data are identifiable, that there are multiple systems of encryption used. Every use of the data goes through a panel of which a third of the members are from the public, and no projects happen unless they have approval and are shown to be in the public interest. But it's not possible with all of those things to identify individuals, so that the data are indeed very safe.
Ronan Lyons, thank you for joining us, Professor of Public Health at Swansea University, Co-Director of the Databank. We will have the First Minister of Wales, Mark Drakeford, on the programme after 8 o'clock. If you have a question for him, if you're confused about the guidelines or angry about them, or think, as we heard from businesses on the Gower this morning, cafes and bars saying, we need a roadmap out of this, we need more detail, get your questions in and we will put them to him. 85058. Time for the headlines.